Hello, my name is Christian Calleros, and I am a student in Philosophy 2306 at APCC. The ethical issue that I'll be covering today is the healthcare system. Now, millions of individuals in the US are unable to afford adequate medications or treatments, and even more are unable to afford simple insurance. Now, the lack of insurance and the lack of medication may make them unfit to work for simple companies, simple jobs. It will make them unfit for simple tasks and may even possibly make them pass away due to the lack of medication. Now, the moral theory that I'll be using is rule utilitarianism. I believe that this would be the best moral theory to use for this, as it would allow for more good consequences than bad consequences. This would allow for a change for rules to be made or a law to allow for people to be uh, allow for more individuals to have access to healthcare and medications. Healthcare is a very important topic to me. I know many family members who are in the healthcare system, and I also know many family members who are unable to afford insurance and who are unable to afford adequate medication. And in the slide here, it shows that in 2013 alone in the US, over 44 million people had no insurance. And since then, there has been an act, the ACA, the Affordable Care Act, which has lowered the numbers significantly. But still, in 2017, there was 27.4 million people who were uninsured in the US. While this number was nearly cut in half, this is still 10% of the population. And this is still 10% who lower the standard of living. This could be changed with very big laws that would have to be put in place for this change to be allowed. If we were to look at the US is one of the richest countries in the world. And if we were to look at the US's closest allies, like Canada and especially Germany, we would see that a lot more of their citizens have more access to healthcare than we do. Now, this is due to the way they have their healthcare system and how accessible it is to afford all of these medications. I believe that a rule utilitarian approach could solve this issue, as we could look at countries like Germany, as I said earlier. Many of their citizens are able to afford insurance and medications, as Germany has a universal healthcare approach. They give all of their citizens insurance, and while these citizens are able to still opt out for private insurance companies, Germany Germany's insurance pays for medications and treatments based off of their income, which I believe would be a lot more fair than making everybody pay the same price. As people come from different backgrounds, people come from different places in their life. By charging based off of individuals' incomes, it would allow for this would allow for more affordable medications and insurance, as it would be based off of their medicate out of their income instead of what the pharmaceutical companies would try to sell that medication for. This would allow for more good, as more individuals are able to afford medications. And really, the only bad would just be the pharmaceutical companies who are selling this, who may not make as much money, but in the long run, they may end up making even more, as more individuals are able to afford these medications and more individuals are able to afford their insurance or their treatments, as they can actually pay for it. In conclusions, millions across the US are able to afford life-saving medications and treatments, and they are unable to afford insurance. Now, this can be easily changed by simple laws or rules, which would allow for these individuals to be able to afford these medications, who will be able to afford these insurances. While the US could take an approach similar to Germany, we would not necessarily be limited to only that. There are still many changes that could be put in place to allow for a better standard of living. This would still follow the rule utilitarian system, as more good would come out. Thank you.